All right, welcome back. And we are pivoting to a bill that has been on our wall for a little bit, and we're just kind of introducing ourselves to the idea of it. And we have in the bill sponsor, Molly Burke, Representative Burke.
Thank you very much, Madam Chair, members of the committee. Thank you for inviting me here and taking some testimony on this bill, H432. This is a bill that I introduced last year. It's a bill that proposes to expand health insurance coverage requirements for prosthetic and orthotic devices. There are other sort of reporting requirements in the bill, but basically, this bill gives a person who has an amputee equitable opportunity to be returned to the full use of their body, because one orthotic device does not suffice. And I introduced this on behalf of my constituent, David Heiler, who was a runner and lost his leg and is very interested in helping other people to find ways to participate as an athlete, not just be able to get around, walk around. And I think that the thing that really struck me in reading the literature is that if someone tears their ACL, very common injury, insurance companies are required to return that person to their full functioning. And so if you think about orthotic device, you might need another orthotic device to be a runner. You might need another one to walk. That would, having the opportunity to have more than one would be able to return your body to its full functioning. So that's sort of, I would say, the essence of it. And I think that probably it would be best for me to turn this over to the experts.
Thank you.
I just want to.
Thanks for introducing it. I know you've been really passionate about this.
And thank you again for making the time.
Okay. So I think we're going to start with David. Is it Heiler or Hiller?
Heiler.
Hi.
Yes,
Hi,
Tyler.
David. Hi, David. Welcome.
Hi, thanks so much. I really appreciate it. And thank you, Madam Chairperson and members of the committee, for taking this time on short notice. And we're really grateful to have this opportunity to speak to you today. My name is David Heiler, despite what it says on my screen. I am the state lead for the So Everybody Can Move movement, which is our national healthcare and disability rights initiative, which is what House Bill 432 is a part of. There are 9,000 residents in this state living with limb loss and limb difference. You don't see many of us out there all the time because Vermont's a tough state to be an amputee in. Weather-wise, it's tough, it's hilly, it's rocky, but it's beautiful and we love it, and we love to be outdoors in it. However, not all of us can access everything Vermont has to offer due to the limitations of the coverage we get, which allows us the access ultimately to the things we love about the state. So basically, and Molly, Representative Burke, put it really well, this bill corrects the inequity to those of us in the limb loss, limb difference community, which allows us access to these devices and restoring us to full bodily function. Insurance coverage provides one device, it's a basic device, to return the amputee to full functionality, which it cannot do. There's lots of functions the human body has, and one device just isn't going to cut it. I wish it really could, believe me. The legislation, So Everybody Can Move legislation, simply clarifies coverage so that people can access more than one device when medically necessary for things like going to work at a physically active job, or physical activities such as sports, or even things such as showering and bathing. I've had a device for 6 years now that is not fully waterproof. I can't take it in the shower or a bath or a pond. Healthcare plans provide the one device, and it basically will cover walking, but that's not full functionality, is it? So the denial usually says that if you want a running blade, or if you want something other than the walking device, that it is not, quote, not medically necessary. And the human body is way more complex than a basic prosthetic can even handle. As Representative Burke mentioned, I've known Molly since I was a kid, so I call her Molly. I'm sorry. As Representative Burke said, you know, I'm a runner, and I ran a bunch of marathons, including Boston a couple of times. And if I were to have torn my ACL, as she mentioned, after one of those races, I would have been sent to a specialist, an ACL specialist, who would not only restore me to walking form, but would get me back on the marathon route. I have friends who've had more prosthetics in them than I do, and from a hip replacement, and that allows them to get back on the slopes. But if I want to do that, I need to apply for a grant to get a prosthetic to get me back on the mountain because insurance won't cover a snowboard leg. Yes, there is such a thing as a snowboard leg. So in essence, our insurance company is providing coverage to restore full function to non-disabled people, as they should, ACL, knee, hip replacements, and all we're asking for in this bill is fairness. I can share a little bit about where we are so far, which I know we're going to hear more about, but I'll touch on it. So this bill has already passed in 12 states, including Arkansas and our neighbors to the north and east, Maine and New Hampshire. It's been introduced in 20 states already, and it will be introduced and or updated in 20 others this year. The reason this bill is so successful so far is the legislation just simply makes sense. It's low cost. It has a huge social impact for people with disabilities who simply want to be independent, healthy, and have access to their basic human rights. It's been a bipartisan issue across the country and receives support, believe it or not, from insurers who recognize this as the right thing to do. I know everybody's going on the big question right now, which is financial. I get that, but we've got a great response to that. This bill has been shown to cost insurance companies pennies, and not even many pennies, per member. In New Hampshire, it's been shown to have cost between 1 and 5 cents per member per month. And the short and long-term savings are very significant. Active amputees, frankly, are healthier, happier, and safer in their lives, which saves potentially thousands of dollars to insurance companies every year. So I'll touch on my story a little bit, and then I will turn it over. So as Representative Burke mentioned, I lost my leg after running a race I didn't lose it after running a race, but after running a race in northern Vermont, a half marathon, I noticed a lump behind my leg that was some softer tissues. I went to my doctor, she said, in Brattleboro, and she said, it's not cancer, don't worry about it, but you should go see an oncologist in Boston. Well, I'm going to go see an oncologist. That must mean there's a potential it was cancer. And it was. It was a chondrosarcoma, which is a rare form of cartilage cancer. And luckily for me, it had not spread to the rest of my body and was isolated pretty much primarily in my knee. My doctor said, we can operate it on it. We can try to get it all out of there. We're going to take it all apart, and you'll have to go through chemo and radiation, and it's going to get infected, and you're going to come back here a number of times. We'll spend a lot of time together, and you'll have basically a tube with a foot that can grow hair. You'll be able to walk. And he said, or you can have it amputated above the knee, 16 centimeters above the knee, and get back to doing all the things that you love doing. So no brainer, right? So I did that. And after a few months, I went to a prosthetist who was specialized, and he was an athlete himself. And I said, I want to get back to athletics. And he's on this call today, Jason Lala. And I got a walking prosthetic after a few months. I spent some time learning to walk. And after a bit of time, I said, I'd like to get back into running. And Jason said, well, you need a running blade for that, and insurance will not cover that. They don't consider it a medical necessity. So, I didn't give up, and I had to fight for that device. And luckily, through a New Hampshire-based foundation, I was able to receive a grant to get a running blade and a new socket. Not everyone is as privileged or as outspoken as I am. It takes a lot just to be an amputee sometimes, and having to fight for your right to run can be too much for a lot of people. What should have happened when I asked Jason is he should have been able to tell me, when you're ready and able, David, as medically approved by your doctor, we're going to submit a request to your insurance for a running blade, and you'll get it as sure as if you'd have to get your knee or hip replaced after an injury. Simply put, movement is medicine, and physically active should be a right, not a privilege. This is Vermont. We're known for doing the right thing. We have such a beautiful state full of mountains, bike trails, ski resorts, rivers, and to deny 9,000 of our state's residents access to the best parts of our state is simply not fair. I respectfully request that you determine to bring this House Bill 432, when you've had a chance to really go through it, to the floor for a vote, and I really thank you for listening. And we got a bunch of great people today. I want to that want to share their experiences and stories with you. Mothers, prosthetists, therapists, young adults, all of whom are disabled or are a parent of someone who is. So I'm going to turn it over to Maggie Baumer right now, who, among many things, is our national lead for legislative affairs. And thank you so much for listening.
Thank you, David. Thank you so much.
My pleasure.
Hi, Maggie.
Hi, everyone. Thanks so much for having me. Thanks, David, for the kickoff. So my name is Maggie Baumer. I am a resident of Massachusetts, but as David mentioned, I'm here on behalf of the So Everybody Can Move initiative, which is a national level initiative, and I serve as the legislative affairs lead for that organization. I'm also a person with limb loss. I have a prosthetic arm and I'm missing my arm below the elbow as a result of a trauma back in 2012. So I wear a prosthesis every day. This is my kind of daily use prosthesis, which you can see is just a mold of my other hand and very much fits my shape and body because it's a mold of my other hand. So it's very useful to me in just doing bimanual activities. But it's not designed for physical activity. So I like to do a lot of hot yoga. And as you can imagine, if I try to lean on these fingers, that's not going to work for yoga. So I need a second prosthesis for those kinds of activities, which this one here is. And I can detach this end, what we call a terminal device, so that I can do other kinds of activities. This one is for yoga, but I have another attachment that would grab onto like a ski pole or a weightlifting dumbbell, something like that. So this is what this looks like. So again, this is deeply personal to me as a person with limb loss. And I mentioned the legislative affairs lead for the So Everybody Can Move initiative. There's also 4 organizations at the national level that partnered to put together the So Everybody Can Move initiative. And those include the Amputee Coalition, which is kind of the parent organization that supports this initiative, as well as the American Orthotic and Prosthetic Association, the National Association for the Advancement of Orthotics and Prosthetics, and the American Academy of Orthotists and Prosthetists. And so we're here to address this clear public health problem that David has outlined, where insurances routinely deny coverage of devices that are specifically designed for physical activity, even though they're essential to our health, our safety, and our independence. So H432 would fix that gap. And as David mentioned, there's 12 other states, including New Hampshire and Maine, that have passed this legislation. We've got 28 states introducing legislation in 2026. And this has only been since 2023. So as David mentioned, this is really catching on because it's the right thing to do. The other piece is that there's precedent here. So we know that through the Affordable Care Act, orthotics and prosthetics are a covered benefit under the Essential Health Benefits Package. And so the issue is that insurances have typically interpreted that benefit to only cover one device. And as David mentioned, we need more than one device in order to participate in all the activities of a full life. So a device for daily use, like David mentioned, could help you walk. That's not even designed for the shower. And some people need a device specifically for showering and bathing, which include different components that are waterproof. Then if you wanted to participate in certain kinds of physical activities, you need a separate device from that. So it's possible that one person could need 3 devices. And again, the reason that that's not currently covered is simply an interpretation by insurance that we only get one. And we're saying that's not accurate, that's discriminatory. It's never been the appropriate way to administer these benefits. And the ACL tear example is a perfect example of why that's the case. And so Jason's on the screen. I believe his patient is a young man named Aiden Collier, who actually testified in favor of this bill in New Hampshire last year. And I met Aiden since then at the Bionic 5K in Boston, and he had his new prosthesis on, his running blade. He was ready to run with a group of his peers. And his mother said he has never been happier or healthier in his life. And so we're already seeing the direct impact of this legislation in New Hampshire and other states around the country. So just to give you a little background about where this is coming from in terms of Vermont state law, as David mentioned, there's about 9,000 people in Vermont that have a limb loss or a limb difference. And we've already passed what's called insurance fairness or insurance parity for orthotics and prosthetics in Vermont. That was back in 2007. And that essentially guarantees coverage of prostheses without kind of arbitrary caps and restrictions as to price or out-of-pocket cost. So we would be building upon that legislation and just ensuring that it includes devices for physical activities. And again, the cost is minimal. As David mentioned, 1 to 5 cents per member per month was the estimate in New Hampshire. And New Hampshire has twice as many people with limb loss and limb difference as
Can you
Vermont.
say that again?
Sure, yeah, the 1 to 5 cents per member per month is our estimated premium increase for New Hampshire. But they have twice as many people with limb loss and limb difference as we do here in Vermont. So it would likely be less than that. We've also seen that there could be millions of dollars in cost savings based on improved health outcomes through the reduction of costly diseases like heart disease, diabetes, and obesity. And collectively, those cost the US healthcare system $626 billion each year. We also know that knee and hip problems resulting from the lack of appropriate prosthetic care can range in cost from $80,000 to $150,000 over a single person's lifetime. So one of the people that started this initiative, her name's Nicole Verkylen. She lost her leg to osteosarcoma at the age of 9, and she had a daily use prosthesis, and she really loved to run. So as she got older, she was running on her daily use prosthesis and actually ran her pelvis out of alignment. So that's the sort of thing that can happen if you don't have the appropriate care, which then, of course, costs the health system more money because of more severe injury. We also have data from New Mexico, where the law has been in place since January 1st of 2024, to show that the premium increases there didn't show up. So out of 4 payers, 3 of them said there was a 0% premium increase, and the 4th payer said there was a 0.001% premium increase based on this legislation. So again, I feel very fortunate to have gotten access to this device through my employer. My employer is Hanger Clinic, and we're a national provider of prosthetic and orthotic care. We have 2 facilities here in Vermont. And yeah, we have to cover this as a covered benefit. Otherwise, we wouldn't really be putting our money where our mouth is. So I was able to get access to this device. And again, it helps me with yoga, weightlifting, skiing, kayaking, and other activities. And I really grew up as an athlete, a competitive swimmer, and that kind of mindset of resilience and perseverance was so key to helping me recover from my injury 14 years ago. We just want all people to have that same kind of access. So that's pretty much it. Happy to answer any questions you all have. We just request your support on this bill, H4 32.
Thank you.
Do you know what current Medicaid coverage is? And does Medicaid currently only cover one device?
Correct. Yeah, that's the general. Pretty much all payers only cover one device at a time. The only payers that cover physical activity devices are the VA. Sometimes a workers' comp might. And so we're working on gathering more data from the VA just to show how beneficial that benefit is. A lot of states, we have a veteran come and testify as to what the device has meant to them, that secondary device. So
I'm aware we have many witnesses too, right?
Yeah, that's okay.
So other witnesses can weigh in on these questions too. You mentioned that that the VA and some workman's comp programs will cover additional devices, devices, sorry, I flipped it. But you also mentioned that that you use the word interpretation, that it's an and I think the previous witness even said that, an interpretation. So what we would be doing is passing a law to make it clear that this is covered beyond those 2 sources that cover it currently. And so that's correct, right? I just want to make sure I'm getting that correct. And the second thing is,
Yes.
Okay. And then the second piece is, and this might be harder to quantify, but what I'm hearing is that people's quality of life improves when they get devices, but that they're not getting the full range of devices to maximize their quality of life, and that's not fair. that alone is reason for me to support it. But a lot of times in this building, we hear about the cost of things versus benefit. And like, what I'm wondering is, what is the financial benefit to society of people having more devices? Like, for example, if a person's quality of life improves, does that improve their other healthcare expenses and thus reduce spending in the system of care over time? Or does a person whose quality of life improve allow them to contribute more economically? Or, not that I need to know that to support this, but I think it might help move things forward if we looked at a bigger picture of the cost versus benefits of providing this benefit.
Sure, yeah, and
Yeah.
you're 100% right. So people who have access to these devices will be more likely to return to work, will be more independent in their function, suffer fewer falls, probably benefit their comorbid conditions like diabetes and obesity if they're able to be more physically active. So yes, it should prevent downstream healthcare costs if people are able to be more physically active and functional. And as you mentioned, it's not just the physical piece, it's the emotional, psychosocial piece of feeling more connected to society, to their community, to be able to participate in sports and other, not even just sports, but just like going to the beach with their family or going for a hike with their family. So yes, and we
Yeah,
will
and
collect. We will collect
Go ahead.
outcomes measurements as well through the healthcare
You do.
system. Yes,
I think.
to say both on quality of life and also on mobility and number of falls and how they're through their physician, how their blood pressure is improving, all of those things.
And I think you'll hear in these stories too, and I know that's anecdotal still, but and I think Dr. Schaffer will talk about this a little bit, is some of the mental aspects of this are huge. Every time you're going to hear about it is like, what makes me happy is running. What makes Gage, when he speaks, is playing hockey. And those things aren't, when you become an amputee, you think, I can't wait to get back to those things because they're so important to my lifeblood. And then you find out you can't unless you go through a lot of hoops and fight a long time to try to get something, from a foundation. So, just wanted to add that.
Leslie, this is your question. Would you be willing to share your testimony with us?
I brought copies for everyone.
Or you can send it
Yes.
and then it'll be on our website.
Yes,
It'd be
okay.
great.
Yes,
Thank you.
thank you.
Thank you, Maggie.
You're welcome. Thank you so
All right.
much. Thanks for having me.
All right.
Do we
Let's
want to get to Gage now? Is
Gage.
that,
Volunteer.
yeah. Take it away, Gage.
Hey, welcome. Thanks for coming in.
Hi there. I'm Gage Pelletier. As you heard, I'm 20 years old and I went through osteosarcoma when I was 15. My freshman year of high school, I got diagnosed with osteosarcoma, went through about 6 months of chemo, got my leg amputated halfway through and came out of it with a prosthetic device, a walking device a month later that I took some time to get used to, but I got used to it. And after about a year or so, I was going back to high school and everything and was trying to get back into sports like hockey and lacrosse. And when I got my leg amputated, I got told that I would never be able to play hockey again. And that was probably one of the biggest things I've ever been told, is that the sport I've been playing my whole life and want to continue playing and was hoping to continue playing all through college and farther on, I was never going to be able to step on the ice again. And with my walking device, I realized that might become a reality. And I tried to play sled hockey a few times and it wasn't really my thing. And I found a couple skating legs that other people had tried. And there were a couple people who, I was a goalie, and there was a kid my age, around my age, who was also playing goalie, and he was back on his high school team. And I was trying to figure out how I can get back to doing it. And there weren't very many options. And I went to my prosthetist trying to figure out if I can get a hockey leg. And they essentially told me it wasn't possible with what I have. And later that year, I realized all my friends who play hockey are also playing lacrosse. And lacrosse seemed much easier to me to get back into because all I would need is a running leg. And they told me the same thing. So I had to go through an outside supporter, which I wasn't as persistent as David, and I kind of gave up on reaching out to them after I got told I got put on a waiting list and wasn't going to get to see it for a while. And I don't even know where that ended up going. And I still haven't gotten a running leg because the lacrosse season went and was gone. And I lost all motivation to apply for it and figure everything out. And those were the two big sports that I was hoping to play through high school and be a part of a team and have all my friends on the same team as me through hockey and lacrosse. And those were things that weren't really accessible to me and were taken away my freshman year. And I wasn't necessarily able to do those ever again. And yeah. Another sport I was hoping to get into was snowboarding, and David mentioned a snowboarding leg, and I got a snowboarding mode put on my leg, which is not as cool as it sounds. I was hoping that it was just gonna take my walking leg and make it a snowboarding leg, and there's a few other modes like this, and they help to an extent, but they're not really what you need. It's really made for walking, and most of the time it just bogs me down. I want to be able to move a little quicker and get to things a little faster, but I have to mosey my way along. I was also unable to participate in any gym classes my high school year. There was a bunch of different gym classes I was excited to take, outdoor adventure and just normal gym classes that all my friends were taking and all my friends were having fun doing, that I had to take an independent gym study and log walking in the woods as my gym credit. And all the fun things happening inside the gymnasium in my high school were inaccessible to me. I just had to go to normal classes. And overall, Bill H432 would have made my high school experience significantly better. I would have been on a team with all my friends. I would have made a lot more friendships and held those friendships throughout all of high school and possibly further on. And hopefully I would have gone to college for playing lacrosse or playing hockey, or been able to continue my passions of being an athlete. I haven't necessarily been able to do that.
Where are you from, Kate?
I'm from Vermont. I moved to Minnesota for a little bit, but I live in Vermont and I've lived in Vermont for all of high school. I live in Moortown right now.
Moortown?
Yeah.
Thank you. What did you have more? I didn't.
I did not. Not really. That was about all. Thank
Okay.
you very much for hearing my story.
That's right. Go ahead.
I appreciate you sharing the impact it had on your high school career. You said you're 20 now, right?
Yeah, I am.
So how could it help you? How might it help you now?
This past winter, I've been wanting to snowboard and it's been hard to figure it out. Vermont Adaptive is a great program and they will help me get out on the mountain, but to get out on the mountain and be out on the mountain every year, I would need another prosthesis. And there's also like going down to the river. All of my friends in the afternoon, it's a hot summer day. They're all going down to the river, getting ice cream at the store down the road and hanging out, swimming in the river. And that's not really something I can do because my prosthetic is not waterproof. It's water resistant, which means I can wear it in the rain. But that's about it. Yeah. And
I hope we can do something to help you now.
yeah.
Thank you.
Thank you.
Thanks, Gage.
Oh, Robert.
Appreciate
Go
that.
ahead. Yeah.
Thank you for.
One more question, but
Yeah.
is there such a prosthesis that would enable you to do that? Because as you were talking, you said, the doctor said you can't do it. We don't have one.
They were telling me that I would need to go through an outside organization, and that then falls all on me. And I wasn't as persistent as David. And I started to reach out to them and started to advocate for myself and started to get the balls rolling. And it seemed like I got on a waiting list, and this was a little over a year ago. And I haven't really heard much since then. And like I said, the lacrosse season went and gone, and I lost motivation because there's now
Yeah.
sports seasons upcoming, but
And I know, I don't know if your question was is there a prosthesis for that? And the answer to that is yes. And you know, if you have more questions for Gage right now, please feel free. But I did want to kind of skip the order because I know Jason has to leave at 3:30, and I think might be a good time to actually.
I think
Go
that
to
would be
the
great,
process.
because I actually had questions, but I think I'm gonna ask Jason those questions.
If
So Jason,
everybody's-
go ahead. Gage, thank you so much.
Thank you.
Yeah.
Thank you so much, Gage.
Hold on.
So, yeah, thank you. Thank you, Madam Chairman and the members of the committee. I was Gage. I mean, hearing that story like chokes me up, literally. So I am, excuse me, I'm a prosthetist for 4Motion Clinics, but I'm also an above knee amputee and have been so since 1989. So I'm going to kind of age myself a little bit here. That was 2 weeks out of high school graduation. I was an avid hockey player, avid lacrosse player. That's what kept me motivated in life. That's kind of what kept even my grades and everything up at that time. Was I was just very passionate about sport, and it was who I was. And so 2 weeks after high school graduation, I ended up losing my leg in a motorcycle accident, and my life was turned upside down at that point. And this is going back to 1989. And I will say one of the differences between then and now is that at least these days, there are things that you'll see on TV. You'll see a lot of amputees participating in sport and Paralympics and TV shows like Survivor and things like that. So the question of are there prostheses that will allow individuals to participate in these activities? Yes, there are. The problem is, as we are, and why we are here today, is insurance companies will provide a single prosthesis as deemed medically necessary and nothing beyond that. So essentially, your everyday walking prostheses is what they will provide coverage for. Now, the health benefits that we were talking about, if you look at the healthcare costs today and what's happening in society in general, we're talking about such an incredible increase in diabetes and cardiovascular disease and obesity and depression. I mean, if you think about the number of school-age people and adults that are now on antidepressants, and I think Dr. Schaefer will be talking about that later on, perhaps. But the healthcare costs associated with that are astronomical, and they're ongoing. So the point is an everyday prostheses. Can I go to work? Yes. Can I walk? Absolutely. Can I go on a short hike? Perhaps. Can I run a short distance? I can get out of the way of a car, but I am certainly not going to go run a mile. There is no way. The amount of force and shock that it places on the remaining joints in my body is significantly higher than what occurs from a running specific prosthesis. So I don't know if this is going to show up well on video, but I'll try to get this close enough to show you that this is the foot of a running blade. I should probably take the blur off, but it's a big carbon J, and essentially it's a large spring. So this prosthesis is designed specifically for running and decreases shock on your body and provides a significant amount of energy return. That is not something that you will find in an everyday prosthesis. It's just, they're not designed for that. An everyday prosthesis has a very basic looking foot. Again, I don't know if you can see this on video, but it's designed to fit in a shoe. A running blade cannot fit in a shoe. And this is designed for walking and everyday use. So again, I would say think of this in a few different ways. Think of it if Gage is your son. Think if you have a child that wants to go on a bike ride or wants to go to the beach. There's a good chance that if you're an amputee and using an everyday prosthesis, you will not be able to join them to do that. You will not be able to go in the water and teach them to swim. You will not be able to get on a bike and go for a 5-mile ride or something along those lines, because the device is not designed to do so. The technology that exists today is phenomenal. There are definitely prostheses that are designed and will allow people to do that. everything from skiing to snowboarding to running to swimming to kayaking, as many, all of those type of activities can be achieved with a prosthesis, but it's just not that single device. Now, while I work for 4Motion Clinics here in New Hampshire, I see a lot of patients in Vermont, and actually my son is now a senior at UVM, so there's literally a piece of me in Vermont. Um, and again, we're talking about being able to allow people to get out there and be active. I think the benefits on physical health are obvious. Anybody that's pre-diabetic, what do they tell you? Exercise and diet. That's pretty much the prescription for happiness, it seems, as well as physical health. And that's why I believe wholeheartedly that this bill is so important. I testified, as earlier stated, for SB 177 in New Hampshire, which we had passed, which mandated coverage for individuals 18 and under. And now we're in the process of a continued battle to make sure that extends into adult years. Because again, while it's fantastic that the 18 and under population is able to receive access to these devices, think about the effects of that. All of a sudden you turn 20 and now you can't continue with running, with doing all these things that you've grown up loving and doing. The other thing I would say is I believe there's implications of generational health involved here as well. If you're a parent and raising a child and you're an active individual, it's far more likely that your children and the rest of your family are also going to be active and healthy. And so you're leading by example as an adult, and you're introducing them to a healthy lifestyle. And again, I think this staves off depression. It staves off obesity, diabetes, all these things that are have such dramatic implications on the healthcare costs for our state and our nation. So I appreciate the time. I was going to try to keep this as short and sweet as possible, and I'm certainly willing to answer any other questions that you may have. I'll tell one little last brief story about myself, because I was also fortunate enough early on to apply to a foundation to receive a sport-specific prosthesis. And that kept me active. And as a matter of fact, I ended up competing for the National Adaptive / Paralympic Ski Team, went on to be able to compete at the Paralympic level. But it defined my life, and it's really why I got into this as a profession, because I thought to myself, like, there was somebody that gave me this opportunity. And if I'm able to return this opportunity to a Dave, to a Gage, to Dr. Schaffer, like that really is where my passion lies, and then the patient care that I provide. And I just think it's, as the New Hampshire State Insurance Commissioner said, this is a no-brainer. This was an individual that said, I am not for mandates, but this is a no-brainer. This is something that we have to pass and support. So I thank you for your time, and I'm willing to answer any and all questions you may have. So thank you very much.
And you're being humble. Weren't you a medal winner?
I brought some hardware home, yes. So
Didn't you bring a gold medal? Yeah.
I may have. And now I want to meet Gage on somewhere in life and get him onto a snowboard so he can.
I was gonna say, I don't know if you all planned this or not, but if you really want to get on the committee's good side, the hockey thing is really selling.
I was a hockey player. I was a center, and Gage is right. I mean, I will tell you, it's a difficult sport to transition into as an above knee amputee, but it's doable, and it's just you need the right equipment. And the one thing I didn't mention is, again, if you think about, let's say, riding a bike. Bikes these days can be extremely expensive, especially if you're going to ride a bike for distance. So let's say you're spending a few $1,000s on a bicycle. Well, for an above knee amputee, it's going to be $1,000 or so for the bicycle, and then thousands of dollars for the prosthesis. It becomes close to impossible for most people of even middle income class to be able to afford to do that. But yet the impact on the insurance and the overall cost is really not that high. And I would certainly believe that you're saving money on the back end. And one other thing that is worth mentioning is Dave threw out the number that there's 9,000 individuals in Vermont living with amputations. This is, in most cases, an amputation can be anything from a finger to a full limb. The other thing you have to consider when you're talking about the costs involved with this scenario is not that population, not everybody in that population is going to be seeking a activity-specific prosthesis. The chances of an 80-something-year-old individual looking for a running leg is probably pretty slim. So we're really talking about, I think they assume there to be about 10 to maybe 30% of that population that may pursue a activity-specific prosthesis.
Just in general, how much does, like you showed us the running blade, how much does
Mhm.
something like that even cost?
Well, that's a great question because you'll hear numbers all over the board in the media and elsewhere. So Gage mentioned something about modes. Everybody's probably going, what is he talking about? I know automatically that he's talking about a microprocessor controlled knee, which is a computer chip controlled knee. And basically what this computer chip does is it takes all this information and it dictates how this knee swings, bends, provides support, etc. Those are quite expensive. Sport-specific activity prostheses are usually pretty basic. There's, as far as I know, there's no microprocessor controlled prosthesis that is used for sport. So when you're talking about a below the knee amputee, which is an individual missing a limb below the knee, you're really talking about the socket, which connects the prosthesis to the body, and then a foot component. So we've had a few individuals apply for some or get grants for some really high-end snowboard-specific prostheses for a below-the-knee amputee, and those were somewhere around the $12,000 range.
I'm sorry, what was that?
Somewhere around the $12,000 range. So it's significant, but it's not $50,000, $100,000, which you may hear at some point. For, let's say, a snowboard-specific prosthesis, which would include now the socket, the knee, and the foot. You're talking usually somewhere from low $20,000 to maybe mid $20,000 mark. Now, the other thing to consider is that all of these devices are modular. They do have warranties, so most of them have somewhere around a 3-year warranty. If anything goes wrong, it's replaced within 3 years. If the body changes and they say you outgrow it or you're whatever that might be, you can oftentimes replace the socket, which is the interface between the human body and the components, knee and foot, and reuse the knee and foot. So like my biking prosthesis, it's maybe not pretty at this point, but I've had it for well over 10 years and it's still phenomenal. And I mountain bike, I come up to Vermont and mountain bike in your state because it's phenomenal riding out there. And honestly, going back to the social aspect of this, I ride with my peers, I ride with my children, I introduce my children to mountain biking and skiing. So again, I believe it has generational impacts on healthcare.
I know that you had to leave, but Topper had one question for you.
Yeah, I think you might have answered it, but how long on average does one of these last? You just talked about switching out something and you put on the old one and it's fine.
It kind of depends. So, and the reason why it depends, like if you have a child, they're changing and they're growing. So, you know, it's, I don't want to say it's as frequent as shoes, but they outgrow certain things. So they will be going through replacement parts more frequently. Again, it also depends on the use. I would say that like a skiing prosthesis, if you will, probably is going to last a lot longer than it may last longer than a running prosthesis because of the demands of the sport are different. Again, the items themselves generally have usually at least 1 year to 3 year warranty. So if the foot was to break or something like that, it'll get replaced at no cost. So I can't tell you specifically. I'm kind of being ambiguous, but not intentionally. But usually, again, Dave can speak to his own snowboarding prosthesis. He's had that for multiple years at this point. So it's not once every year, that's for sure.
Thank you.
Thank you. Thank you, Jason, for joining us.
Thank you.
All right,
Yeah.
Brian?
Hello.
Hi.
Ryan McLaren. I live in Essex Junction. And thank you, Chair, for letting us come in and talk about this. I first off wanted to just talk about some of what Gage was mentioning and just sort of be concrete about some of these things. Like I'm not a person with a limb loss, but I am a proud athlete and adaptive athlete now, and was paralyzed skiing, doing what I love, 8 years ago now, almost 9. And I just want to sort of talk about the decision-making process. So if you are someone who relies on a prosthesis, I use crutches and braces to get around, and I want to go to the beach or I want to go snowboarding. Like, you have to make the calculation in your own mind. If you're using something that's not designed for that, like, am I willing to be homebound practically? Because I might destroy that device doing something it's not meant to do. And it's a real limiting factor on what you can decide to engage in as someone living with a disability, because you are using your prosthesis for everyday life, and you want to be able to participate in everyday life. And so having to make this sort of trade-off of, like, is snowboarding worth it for me to put at risk a prosthesis that is not made for snowboarding, and I might destroy doing this thing and be stuck. So I want to start there, just as we were talking about some of these things. But like I said, I'm here as someone living with a spinal cord injury and someone who's been an athlete his entire life. I grew up in Essex, playing hockey, undefeated state championship hockey team at Essex High School in 2004.
Essex High School's really good, Tom.
And going to the pond hockey.
That year.
The banner's still there. My daughter's playing hockey now at that same rink. I'm going to the pond hockey classic this weekend with a bunch of friends I played hockey with growing up. My experience as an athlete shaped my entire life, and it shaped particularly my youth. And I am being an athlete and being a part of a team gave me confidence. It gave me drive. It gave me motivation. And, it taught me how to be part of a team. It taught me how to live in a community. And I am an evangelist for the power of youth sports and youth, not just sports, but building community with kids. And as a result of that, I coached lacrosse at Burlington High School for 15 years. I coach with Essex Youth Lacrosse now. And in both of those forms, as an athlete and as a coach, I have experienced them as an able-bodied person and as a disabled person. And it was just as essential after my injury to finding myself again, to feeling a sense of community, to feeling whole in my body and in my life as it was beforehand. So I was injured in 2017, and it's hard to describe that experience, but I was lucky enough to come home to Vermont, which is a place where we have world-class resources in adaptive sports and world-class organizations, making sure that Vermonters, not just Vermonters, but all people get to access what makes Vermont special. Our outdoor recreation, our landscape at Vermont Adaptive, Kelly Brush Foundation, the High Fives Foundation, all of those groups, Green Mountain Adaptive Sports, there's a number of them, and all of them made the life that I have today possible. I wouldn't have the family I have. They changed my life. And I feel so grateful for that. But in some ways, that is luck. It's a product of luck. I was born here. I came home here. And they just happened to be here. Kelly reached out to me in the hospital when I was still in ICU UVM. High fives. Reached out to me when I was at Spalding, and they told me that it's not going to be the same, but it will still be awesome. And they were right. The experience of being on a ski slope, riding through the countryside as an adaptive athlete or a regular athlete, it's the same. It's the same sense of freedom. It's the same sense of awe and the beauty. It's that sense of, being alive. But my experience is also the function of like social capital. Like people found out I got hurt and they reached out to me. People, when I came home, I knew who to talk to. I had the resources that someone like Gage, if you're in high school, might not have. And so, I started on second or third base in this conversation, getting back to the life that I wanted for myself. And that made me feel like me again. And what is so special about Vermont is like we value these things, but I don't think we can leave it to chance to have folks that go through some traumatic injury or have some horrible experience to get back to a way of life that we value as Vermonters. And this bill will help fix that inequity in our system. And I think it's really important for kids like Gage to come home to an experience where they can live their life the way they should. And it's particularly important now, given all the resources we have and given how special Vermont is and how seriously we've taken accessible outdoor recreation and adaptive sports. And the fact that the Paralympics are about to start. It's like we can be a part of something, continue to be a part of something as a state that demonstrates our commitment and our values to those things. Because if you look at the Paralympians there, like they had experiences probably a lot like Dave did, where like they got there through like fundraising, philanthropy, or some other way of like piecing together the opportunity to compete as an adaptive athlete. That's not true for the Olympians. Like you tear your ACL downhill skiing, like an insurance company is going to cover what it requires to fix that. But if you aspire to be a Paralympian, that's on you. And that is not fair. So thank you so much for having this conversation. And, you can hear from the actual experts.
Thank you.
And I'll take
Thank
questions.
you, Ryan, and thanks for your advocacy on this. Really.
Thanks. Yeah, it was a long time ago. I'm still living in the glory. Tell my daughter every time we're in the hockey rink, that's Dad.
Jacket.
So I got it out to go to the Pond Hockey Classic.
Okay.
I will be wearing it this weekend.
Next, we have Jennifer. Jennifer, please tell me you play hockey every single day.
Okay. I don't play hockey. I'm so sorry, but my son does play sled hockey, so we can talk about that. Hi, thank you so much for having me. My name is Jennifer Bisson. I'm the mom of a 14-year-old who has a limb difference. My son Marcus, and hi Gage. I know Gage and can attest to his wonderful hockey playing skills. So my son was diagnosed at 10 years old with metastatic stage 4 osteosarcoma, which is crazy in itself. And then what you don't know when you hear the word cancer, when it pertains to your kid, is that the only way to get rid of osteosarcoma is to get rid of the limb that it is in. So not only do they tell you your child has cancer, but then they tell you, and he's going to lose his leg. So tough thing that we went through a couple of years ago. Now, my son is a rotation plasty amputee, which is a little bit different than what we've talked about so far, but he wears a prosthetic on his right leg to be able to access the world around him. And he's 14, so he's in 8th grade getting ready for high school. And there are things that his everyday leg don't allow him to do. Like we've talked about already, he was an avid snowboarder, not a hockey player, but avid snowboarder prior to his cancer diagnosis. He did get into a snowboard in the backyard, but in order to be able to snowboard like he did prior to his cancer, he would need a special leg for that. I'm also the mom of 5 children, so he's one of 5. Our favorite thing to do pre-cancer was the beach and swimming, and that's not something that's accessible to him now. So he has to choose, do I go with my family to the beach and deal with potentially ruining the leg the only way he walks, or do I stay home? And that seems ridiculous that he would have to do that. So, you know, Marcus is growing fast, so we are getting new prosthetics, currently about every 8 to 10 months. So that's a, you know, interesting thing. His amputation, basically they took out the middle of his leg, they flipped the bottom of his leg 180 degrees and reattached it to the top of his femur. So he's considered a below the knee amputee, where his ankle and his heel act as his new knee joint on that leg. So when Marcus, when we were given the options for what types of amputations, we were told that this rotation-plasty amputation would give him the best chance to be the, you know, most active kid that he could be, which he was at 10 years old. And they weren't wrong. It has given him the ability to do things like jump on his 4-wheeler, get on the trampoline with his siblings, ride a dirt bike. He can't ride a bicycle, which has been difficult with a large family who likes to be active in our beautiful state. But, you know, we're still figuring that out. So, so everybody can move is more than just about a prosthetic for Marcus. It's about equity and dignity for him as a middle school boy. Twice this year, his school was given the opportunity to send their entire middle school to a water park. So as long as their middle schoolers behaved, it was an incentive. They got to go to a water park. Marcus is a great boy. He listens, follows directions. He's an empath. He's a beautiful student and a lovely human. And that was not accessible to him. He can't go to the water park as an incentive. So he stayed at home with us, which is hard. He shouldn't have to make those decisions at his age. So it's more to him, you know, 14 is a tough age. I'm also a middle school assistant principal, so I deal with 5th, 6th, 7th, and 8th grade children all the time. And this is just a really integral growth and development time for children. And he deserves to be as similar as his peers. And so this, So Everybody Can Move, House Bill H432, would mean so much to him and so much to other children going through what he's been through, and other children like Gage to have the opportunity to participate in things like their peers. So thank you for listening.
Thank you. Thank you, Jennifer.
Yeah.
Really appreciate. Where do you all live again?
So we live in Williamstown, Vermont.
Okay. Look at that.
Wow.
It's like everybody's here for Topper today.
I topper and I work at Berry City Middle School. So
Great. Thank you. Thanks for being here today. And Marcus is not, he had to go home. He had to.
he's homesick with the flu.
Of
course.
It's going around, unfortunately.
Yes, it is really bad.
Thanks. Next we have Sue Schaefer.
Hi, I'm Sue Schaefer and I'm in South Burlington,
Sue.
Vermont. And I'm an amputee. I'm also a psychotherapist, but I'm going to speak personally what it's been like for me. In 2018, I was walking across a crosswalk to Jeffers Hall on University of Vermont's campus and was hit by a Catamount bus. So they were clearly at fault, and I got a settlement, which helps to pay for some of my recreational devices that other people wouldn't have access to. But just like everyone's been saying, I'm a below the knee amputee. I was very active prior to losing my leg. The prosthetic device I have is not waterproof. My daughter, who was sitting here earlier, was 3 at the time. And so we had an active family and would go to the lake and would go to the beach. And because I'm a below the knee amputee, I didn't have the chip devices. So even though it wasn't waterproof, I took it into the water and the foot shell would fill with sand or grit. And still does. Most recently, a couple weeks ago, I needed a new foot. So I didn't need to replace the socket or the pylon, but I needed a new foot. And the insurance covered so much of it, but $2,000 was out of pocket. So a lot of people can't afford that. That's cost prohibitive. But because of my settlement, it allows me, the idea was that I could live the type of life I lived prior to the accident. I applied to the Challenged Athletes Foundation to get a running blade because I wasn't a runner, but I jogged and I liked to jog. And I was granted one, but it didn't cover the socket. And so Jason's my prosthetist, and it was I think the socket was it was more than $2,000. And I said, well, let's appeal to, the insurance companies that it's medically necessary, and it's medically necessary for my mental health. That when I can't chase my daughter, when I can't play tag with her and do the things that I used to do, it's very depressing, and my world gets smaller. I have to make these choices, like people were saying. Choosing not to do this or to participate in that. Your world gets smaller, and it's very discouraging. And on top of that, everyone who loses a limb, there's a trauma involved, so there's a foundation of trauma, and then you're trying to take care of yourself after. And if you don't have access to the activities that support you, it's problematic. And when I go out, I go to the pool in Burlington, or I do this. I'm like, where are all the other amputees? I don't see many amputees out. And I wonder how much of that is that they don't have access to some of the things that I've been able to benefit from. And it just broke my heart to hear Gage's story about not having access to these devices, because it does affect your quality of life in a profound way. So I really hope that you can support this bill.
Thank you. So,
I know we're short on time, but you bring a unique perspective because you are a person with lived experience with having an amputation and using these devices, but you're also a psychotherapist. So you're an expert on mental health. And you just said that it's essential for mental health. And I'm just wondering if, for the record, you could say a little more about how it could harm someone's mental health, from a clinical perspective, not personal, but from a clinical perspective. Like if you had a client and they lost a limb and it cut them off from these activities that were maintaining their health, what might be the negative mental health outcomes we would see from them not having inclusion in social activities, or them not having physical activity and exercise, or any of the other benefits that might be affected by the medical condition?
Sure. And a lot of it, you guys can just even surmise in terms of what the impact is, but not having we know what the physical activity, the impact it has on the brain. We also know the impact of being depressed and how that affects your day to day. For adults, not wanting to get out of bed, not having the energy to do the things that you used to get excited about, not having, being on your game at work, being attentive to your family, depressive symptoms keep you from being your best self. It's also increases your stress to have worries and fears or not being able to be included. It seems like anxiety is ever present these days for so many different reasons. And one of the ways to deal with anxiety is through physical activity, through feeling a sense of belonging and connection to your community at large. And so the impact is on all of these things. Your traumatic, your PTSD symptoms can be amplified if you're not able to do the things that you used to doing for self-care. And, if there's a genetic disposition to any sort of mental health conditions, not having access to these things does not help those conditions.
I want to just be more direct.
Sure.
Trigger warning, but because it's like I'm just going to be real. Like, do you think that providing access to these kind of adaptive technologies or medical interventions, prosthetics, would it prevent suicide? Would it prevent substance use issues?
It could. I mean, I can't say.
Yeah.
Definitely. I think when you don't have access to prosthetic devices, period, absolutely. But I do think, in the communities that I'm involved with online, there are a lot of amputees and those with limb loss suffering from mental health issues. And I don't know what percentage having access to the recreational running blades, skiing blades, things of that sort would improve it would definitely improve the quality of their life for those people. Yes.
I appreciate you being honest and saying you don't know exactly, but that. Yeah. And the reason I ask is those have been two priorities of this committee is to prevent suicide and to address, and the legislature is doing a lot to address substance use disorders. And I just, I was just curious, and that might be something we do get more info.
As a clinician, I think a lot is because of social isolation, that contributes to suicidal behaviors, and that the more you have a sense of belonging and connection and access, that diminishes. I think that increases survival rates and things of that sort. And so I think through that lens, absolutely.
Thank you.
David, did you want to make a comment as well?
Yes, thank you. And I've done some research on this, and they've found in studies that there are, not to be too dramatic here, but there have been studies shown that 30% of amputees at some point will entertain suicidal ideations. And we all talk about the prosthetics and how important it is to have that, but to move and to do all that and physically, but the mental aspect of this it doesn't go away. I don't care if you've been amputee since 1989 as Jason, or 6 years for myself, or everybody, every day, you never forget. And I think that is really why it makes it so important. So.
Thank you. And thank you, Sue. Last witness we have is Megan Muller. Hi, Megan. Thanks for joining us.
Hi, everyone. Sorry, I'm not really Christine. I'm Megan. I'm from Wells, Vermont, so down south, closer to Manchester. I'm here on behalf of my son Carson, who is almost 2.5. He was born in November. Carson was born with what's called proximal femoral focal deficiency, better known as PFFD. It's a rare birth defect that affects 1 in roughly 200,000 children. Which for those of you that don't know what that means, as I assume most don't, he's missing his femur in his left leg. So he was born missing almost a completely absent femur. It's not measurable on imaging at this point. So Carson, from the time he was born, has had life challenges, learning to sit, crawl, walk, run, which he can't do yet, just turning 2. So prosthetic limbs for young children are not optional, in my opinion, or cosmetic. They're medically necessities to provide devices to support physical development and balance muscle growth and long-term mobility. As children grow, as I think it was Jen said, or that they can come as early as every 4 months. So Carson's last prosthetic lasted roughly 4 months before we were back at the Hanger Clinic and casting him for a new prosthetic. We just picked up the new one a couple weeks ago, and we're already heading back to Hanger next week for another adjustment, as his is a little different. It's not a straightforward prosthetic. It's called a foot-on-foot prosthesis. So every time Carson's foot grows, he needs a new socket, which we made a whole new shoe size in December just in itself. One of the greatest challenges that I find is the insurance coverage. While basic prosthetics are sometimes approved, insurance providers often refuse to cover specialized prosthetic devices, such as ones designed for running, swimming, and any form of active play, claiming they're non-essential. For a child, these activities are not luxuries in my mind. They're fundamental to healthy development. And overall, the child's emotional well-being would be affected by that as well. Children like Carson deserve the ability to run and play with their peers, play on a playground, participate in swimming, and play any outside school at sports, just like anyone in his class that he'll be going into school with. This is how they build their confidence and independence and sense of belonging. Denying access to the appropriate prosthetic devices not only limits mobility, but opportunity in life. Cost of the specialized pediatric prosthetics are extremely high from what I've found, often reaching tens of thousands of dollars per device. For an example, Carson's prosthetic that we picked up in January of this year was billed at just shy of $12,000 to the insurance company. Our cost was $4,000 something. And you figure I said that'll last about 4 to 6 months. We lucked out and we have joined what's called Jordan Thomas Foundation. So it's a foundation based out of Tennessee. And they have taken on Carson as a lifetime beneficiary. So they will cover all of Carson's prosthetic needs through the age of 18. However, in Vermont, there's not anything that I can find that's even close to being similar to that. So if Carson does decide he wants to play hockey like everyone talks about, which is my ultimate hope. As a mom, I would love for him to play hockey, actually. That's one of our go-tos. He could get whatever he would need through Jordan Thomas. They don't deny coverage for whatever Carson would choose to want to do, whether it be snowboarding, swimming, and all of that type of stuff. So overall, the H432 represents an important step towards ensuring the children with limb deficiencies and mobility differences receive equitable and comprehensive insurance coverage for prosthetic devices that are medically and developmentally required.
Thank you. Any questions for Megan? Well, thank you for joining us. We really appreciate it. And I know that we put this together quite quickly. And so I just want to reach out. I just want to say thank you to everybody that worked with Tasha, our committee assistant, in getting this ready and as well versed as it was. So thank you.